So I was involved in a pretty serious motor vehicle accident back in March. My whole back flared up. I was limping coming out of the vehicle. So I would get adjusted 2 or 3 days later, same pain would come back. And towards the end of the week, from me bending down, seeing patients, my low back was on fire.
What we typically see, especially with like a Discseel procedure, is we see relatively quick, outcomes, just because that has a relatively immediate effect.
I was pain-free, for the first time in a long time.
It's been about 3 months. So why don't you give me kind of a rundown of where you're at currently?
Yeah.
How things are going?
So currently, I really haven't had any low back pain at all. Like working, everything. I've even gotten back in the gym and not doing anything crazy heavy yet, but I've gotten back to the gym doing some regular exercises that I used to be doing, and I feel great. I think I used to get at least one chiropractic adjustment a week just to keep everything at bay. And I think I've needed one or two in the last, it's almost been 4 months at
Wow.
this point. I think I've needed one or two, and it really wasn't even that bad. So the ligaments are just holding everything in place now that it just wasn't happening before.
Yeah, that's awesome. I love to hear that. How's the neck and the elbow? How you doing there?
Great. So one of my biggest problems besides the low back was at T1. T1, T3 would always, lock down on me. And like I said, it's been great. It really hasn't been an issue. The elbow feels better when I'm doing the tricep pull downs. I don't feel like the tricep's going to pull off the bone anymore. It feels
Perfect.
stable. Yeah, that's been great. It's been
That's
great.
awesome. So give
Yeah.
me an idea just in terms of the progression, like how long has it been like that? Has it been gradual sort of in terms of the improvement?
The first 2 weeks I was incredibly sore, obviously, because I got a lot of injections. So the first 2 weeks I was very sore, and then after the 2 week mark, I started to feel significantly less amount of pain. And then I think around the 5 or 6 week mark, I started slowly getting back into the gym, and it was the first time me working out since the stem cells and the PRP. So I was sore after a couple days, but nothing crazy, just because everything was getting used to its new position. And then, this month I started not lifting like heavier, and I'm really not that sore anymore after the workouts. My back feels good. Honestly, the biggest thing for me is towards the end of the week on Fridays after adjusting people, because I'm constantly bending down, I would always need an adjustment. And I'm just like, I'm good. Like I'm just good. Like I'm bending down, touching my toes, feeling better range of motion. Even the thoracic spine is looser.
That's awesome.
It's been great.
Yeah, no, that's awesome. And like it's still early. I know that's really difficult for people to wrap their heads around, right? So
Yeah, yeah. I want to talk to you guys about that.
yeah,
The healing, what it can take, like rapid repair can take place even through like 9 months, right?
yeah. So what we know is once we place actual stem cells, they can live in that space for 12 to 15 months on average. So
Wow.
they're actively healing, controlling the environment, doing what they need to do. What we typically see, especially with like a Discseel procedure, is we see relatively quick, outcomes, just because that has a relatively immediate effect. Like fibrin works at a different pace than maybe the regenerative or the stem cell, the bone marrow procedures do.
Okay.
So, and again, because we treat a wide variety of tissue, that some things heal faster than others.
For
Some things
sure.
are more injured than others. So it's really just a progression over time that we look for. But at
Yeah.
the end of the day, you're young and healthy. Like we kind of
Yeah.
expected this kind of outcome.
Yeah.
More importantly, we're going to continue to see repair over time. And if we have
Yeah.
a positive outcome at this stage of the game, it's a really good indication we're going to do well long term. So,
Yeah.
at this point, exercise, stability protocols, all of the above, that you're a doc, like you get it.
Yeah.
Those are all going to pay dividends long term. Like we're at the
Yeah.
stabilization phase now. If symptoms
Yeah.
are doing as good as they are, then what I would say is just get back to doing what you need to do, and you're doing great. I mean, it's awesome.
Yeah. Question for you. So I was feeling so good. I know on the paper you guys gave me, it said no sit-ups or anything, and I was feeling so good. I did about 15 to 20 sit-ups last week at the gym, and that was the only for 2 days, only 2 days. I felt pain in that L3, L4 area. Like a little bit burning down the leg, a little bit pain locally at L3 or L4. After 2 days, it was gone.
Okay.
Now, and it's funny when I just do like leg lifts, like if I go on that machine in the gym and lift my legs up to the stomach, I'm fine. But the actual like motion,
Force
like
flexion.
force flexion, did bother it.
Yeah.
I'm not concerned. I'm just, when do you think it would be? Because I'm not going to do it again for a while. When do you think it would be okay to test it again?
It's a great question. Listen to your body. It's the best.
Yeah,
It's the best answer I can give you.
yeah,
Because everybody's a little bit different.
yeah,
It's highly variable. So, for you, maybe that's a little bit longer, but that's exactly what we look for, right? So,
yeah,
if we experience a flare up or a little bit of extra pain, remember that the healing process is time dependent. So at the end of the day, just back off a little. Don't do that activity because
yeah,
it's compressing or irritating an area that hasn't had the chance to heal fully.
yeah,
And then just use that as the best measuring stick possible. Like start maybe with static stuff,
yeah,
right? Or anything because like force flexion is going to put more pressure on the discs and
right.
ultimately you may flare it up a little bit. But the fact that it only lasted for a day or two
Yeah,
is ideal. That's kind of what we're
yeah,
looking for,
yeah.
right? Again, short answer is use your best judgment.
Gotcha.
But we
Gotcha.
want you to continue to scale in
Yeah,
active exercises, dynamic activities, all of the above, because what we're really looking for here is the long term outcome, right?
absolutely.
Yeah, yeah, without a doubt. So you happy, dude?
I'm so happy. It was one of the best things I've ever done, I think, for my body for sure.
Yeah, no, I'm really glad for you. I'm happy for you,
Yeah.
bud.
And my wife too. I mean, she's had chronic low back pain. She hasn't complained once in the last like 3 or 4 months either. Like maybe I've checked her one or two times, just little light adjustments, but she's been so good too.
It's pretty awesome. And, I love treating docs that understand the process. Like conservative care is wonderful, but at the end of the
Mhm.
day, we reach a threshold where the damage is so significant that it can only get us so far. And then
Yeah,
before we ever make a decision to manage the pain or do surgical intervention, regenerative medicine is a really nice tool to fill that gap.
absolutely. I
Yeah,
agree. Yeah,
cool.
yeah.
Look, you got anything else for me, bud?
I would love to do a testimonial for you guys. I could definitely leave a Google review. Did you guys do video testimonials as well? Do you need anything from me on that end?
I appreciate it. Why don't you do it here?
Okay. So I was involved in a pretty serious motor vehicle accident back in March. My whole back flared up. I was limping coming out of the vehicle, and I am a chiropractor myself. And so the first thing I did the next week was I started getting chiropractic adjustments, and it would help immediately. But 2 or 3 days later, the same type of low back symptoms would come back, which to me felt like I had some ligament laxity going on in the lower back and in the upper thoracic. So the adjustments were helping, but they weren't really staying in place as well as they used to. Um, so I would get adjusted 2 or 3 days later, same pain would come back. And towards the end of the week, from me bending down, seeing patients, my low back was on fire. So I had a really great referral over to Orthobiologics, and I didn't know about some of the new procedures they were doing. I knew about stem cells, I knew about PRP. I had no idea about this Discseel procedure because I had herniated disc, a pretty severe herniation at L4, and a couple of my other discs in the lumbar spine were bulging. And then Dr. De Pasquale recommended Discseel. And I was a little nervous because I never heard of it before, but I saw some of their testimonies, how it helped a lot of their patients. And even going into the procedure, I was kind of nervous about it. And the doctor that was giving me the injections really put me at ease. She says it's a great procedure. She does it all the time. She sees a lot of great outcomes with it. And I'm so glad I did because Originally, I was sore for about a week, week and a half, 2 weeks, and then after the 2 week mark, my back was like I didn't have pain anymore, and I was able to see patients like throughout the whole week, which is what I love to do, and I was pain free, for the first time in a long time. And I plan on doing this for the next 10, 20, 30, 40 years. And with the current state of my low back pain, it just was not going to be able to happen. So I'm so fortunate. I got the Discseel in conjunction with the stem cells and PRP. I'm 4 months into recovery. I don't have any low back pain anymore, which is crazy to say because it was an everyday occurrence, and I was starting to get worried because it was affecting work, my well-being, and what I do. So the stem cells were great, the Disc procedure is great, the PRP injections, the staff was excellent, comforting, and they're doing injections. There's needles. You have to be very precise where you put the injections and everything. And the doctor, staff, and team was great. They hit all the right areas. I couldn't be happier with the outcome, and highly recommend anybody that's looking into the Discseel or PRP. It's a great procedure. Give yourself some time to heal. One of the best decisions and investments I've made in my body is doing the Discseel and the PRP and the stem cells.
That's awesome, brother. I'm really happy for you. I'm glad everything worked out well. And it always makes me happy to help someone who's passionate about helping others, right? So that's fantastic, dude. Hey, I look forward to speaking to you down the road. I'm sure you'll be doing even better than you are today.
Yeah.
But we'll talk in terms of like another reevaluation, maybe in another 3 months' time. We'll just have a brief conversation, okay?
Sounds great, Doc.
All right, man. Have a great day.
You too. Thank you so much.
Thanks again. Appreciate it.
Absolutely.